Welcome to SDM Righty Academy. So let's start with the basic of pharmacology, the basic concepts, terminologies on pharmacology. So that you can, it will be easy to learn the deep knowledge of pharmacology. So don't stress too much about pharmacology. Love is the only drug we all need now. Let's love pharmacology and enjoy the process of learning. Shall we enjoy? Yeah. So why do we need pharmacology? Can anyone guess? Why do we need pharmacology? So right from the birth of man, right from the man's inheritance, there was a birth of illness too, and there was a search of remedies too. So search for remedies for all the illness is not new, is comparatively old. Okay, that's why the pharmacology came. Pharmacology is just a study of drugs. This came because of this wonderful man. Do you identify this person? Yeah, he is Hippocrates, a great Greek physician. He used his knowledge of medicine to analyze and gave some natural remedies, magical remedies too, and then this developed into Ayurvedic medicines. Then homeopathic medicines were found, then allopathic medicines were found, and there comes the need for pharmacology, where the medicines has to be purified and effective and safe medicines are in need. So pharmacology is nothing but it's a combination of two terms, that is pharmakon and logos. That is pharmakon, the word pharma, it's drug, and logos, it is study. So study of drugs is pharmacology. So we are going to study drugs. So before going into pharmacology, you need to know some branches of pharmacology, that is pharmacy. As soon as you see this, you will be remembering only about dispensing. But pharmacy, apart from dispensing, it also does so many things like compounding of drugs, dispensing of drugs, etc. And clinical pharmacy. Clinical pharmacy is the emerging field now. So clinical pharmacy do greater activities like counseling the patients and checking whether the patients are taking the medications properly, whether they are adhering to the medications. These are their roles, and they check for the errors in the drug therapy. This is one of the emerging field now. And therapeutics, with the knowledge. So with the knowledge of pharmacology and with the knowledge of physiology, that is medicine, with these two knowledges, applying those knowledges in giving the right drug to the right patient is what therapeutics. And toxicology, with the term toxicology, you all remember toxic, that is poison. So toxicology is the one who knows about the poisonous drugs and how to manage it, what is the antidote, and what are the symptoms of the toxic poisons, and this is what toxicology is. Next one is pharmacoepidemiology. So finding the drug and applying it to a larger population, that is giving it to the larger population, and finding the efficacy and safety of the drug. One drug is taken and it is checked in a larger population for its efficacy and safety, is what the pharmacoepidemiology is. And moving to the pharmacoeconomics, with the term economics, you all know that something but the cost. So cost and effectiveness. So for example, in paracetamol, basic drug paracetamol, you have many brands, for example Dolo and Calpol, and finding the difference between the cost and which is effective and giving it to the right patient, it's what the pharmacoeconomics, the balancing of the medicine and the cost. And pharmacovigilance. Pharmacovigilance is every drug basically produces the side effects. So the finding out the ADRs reported in patient, that is ADRs, adverse drug reactions reported in patients, and analyzing it and documenting it will further helpful in the future treating the patients. Then pharmacogenomics. So genomics is the one of the emerging field like clinical pharmacy. So with the gene, with the DNA of a particular person, you can design a drug, you can cure particular disease with the right dose. So quite interesting, right? Yeah. So next, moving on to the two important concepts of today is not only today, the concepts of pharmacology is based on the two terms, that is pharmacodynamics and pharmacokinetics. So pharmacodynamics, D. You will get confused between these two terms when someone asks. So you can remember the D term in pharmacodynamics, that is D, that is drugs. What drug does to the body. So how to explain this? So if you are taking a drug to the body, and what changes it does to the body is what the pharmacodynamics is, basically the mechanism of action of drug. So next, moving on to the pharmacokinetics. Kinetics is nothing but simple, ADME. So remember this term, ADME. In pharmacodynamics, D, that is drug does to the body, and here ADME, absorption, distribution, metabolism and excretion. So what body does to the drug? So when the drug is taken inside the body, what changes does the body do to the drug? So for example, a drug is taken and how it is absorbed by the body, and how it is distributed into the body, how it is metabolized into the body, how it is excreted by the body. So this is what the pharmacokinetics is. So these are the two important concepts which will be studied throughout the pharmacology of every drugs. So today's question, let's see the important session of today. Let's see who finds out the answer and just comment it. Find out what are the various sources of drug information. So how a particular drug information can be retrieved, and what are the various sources. Please comment it. And this is the today's question. And next class you will be seeing about the different routes of administration. So till that, stay tuned. And to join our classes, the basics of pharmacology, not only the basics, the complete second year pharmacology, just visit the link below. Thank you. Have a nice day.